A 21-year-old woman comes to the physician for a regular checkup. During the patient interview, she admits that her college friends have invited her to a party the following week, and she suspects there will be illicit drugs at the party. She asks the physician for advice for staying safe when using recreational drugs. Which of the following is the most appropriate response by the physician? Choice A, inform the patient that this falls outside a physician's field of expertise. Choice B, advise her on the dangers of taking recreational drugs. Choice C, educate her on the most common types of recreational drugs. Choice D, ask if she wishes to engage in drug use. Choice E, report the use of illegal drugs to the authorities. I'll wait 5 seconds and answer the question. I know I sound like a broken record, but yes, it's an ethics question, and yes, you're supposed to ask open questions. Now, I know in this case, some of you may be stuck between choice C and D. Not much to say to that other than that you need to read these questions carefully, because here it doesn't seem like the patient has actually made the decision that she's going to use drugs yet. In fact, she's not even sure there are going to be drugs at all. So really, it's as simplistic as you asking questions to clarify where she's at. So choice D, ask if she wishes to engage in drug use, is a better answer. Not much to say there, right? So let's look at some of the other choices here. Choice A, inform the patient that this falls outside a physician's field of expertise. I mean, this is just blatantly wrong, right? Not only is substance abuse an important aspect of medicine, you actually need to know several drugs of abuse for the step 1 exam. So I really hope nobody picked this answer choice. Choice B, advise her on the dangers of taking recreational drugs. Clearly too paternalistic, a little judgmental. And once again, you're kind of jumping ahead of yourself. You're automatically making the assumption as that she will be taking illicit drugs. And beyond that, you're jumping straight to giving her advice that she might not actually want. So pretty straightforward there. Choice C, educate her on the most common types of recreational drugs. As I already mentioned, it's more important that you clarify what she's actually going to do before you jump into something like this. Now, once you've established that, yes, she's going to use drugs, yeah, you can give her some advice, and it's perfectly ethical to give harm reduction counseling. Finally, choice E, report the use of illegal drugs to the authorities. First of all, we call this being a narc, but more importantly, even if the patient has already admitted to either wanting to use drugs at the party or she's already using illegal drugs, if you just think about it, it's like you would never report that unless it's a case of some kind of abuse, like somebody's forcing someone to use drugs somehow, or she's an imminent danger to others. Those are pretty much the only situations where you're allowed to break confidentiality like this. So not only is this you being a narc, but it's actually unethical and illegal. You're breaking patient privacy, not much more to say there. Hope you found this video helpful. I'll see you in the next one.